Karen Buckenheimer, and I am so excited to welcome you tonight to Tampa General and Morehealth's virtual health event focused on poison prevention. So Morehealth is a nonprofit organization, and we go into the schools and we teach health and safety lessons, many focused on nutrition, bones, health, skin cancer prevention, poison prevention that we're going to talk about tonight, even firearm safety and bike and pedestrian safety. We teach these lessons one class at a time in schools, kindergarten through high school, throughout the Tampa Bay area. Over the last 30 years, we've taught over 4 million students, and that's one class at a time. Our lessons are integrated into the school's curriculum to help enhance the students' knowledge on health and safety. So two of the lessons that we're going to be specifically talking tonight, especially related to the COVID-19 pandemic, is our poison lessons. We teach these lessons in elementary school, and most of the time these lessons focus on having your home poison-proof, poison-safe. So for example, we talk about poison lookalikes. So poison lookalikes would be, for example, I just happened to grab this out of my kitchen cabinet. This is a great floor cleaner, and but it would be poisonous if I drank it, but it looks very similar to my iced tea, also very similar to apple juice. So we teach children the importance of making sure that they don't eat anything or drink anything unless they have parent permission. So it's very important to make sure that our kids follow very safe rules in regards to poisonings. So tonight, I am extremely honored to welcome and to be joined by Dr. Douge, and she is the Healthcare Education Specialist at the Florida Poison Information Center at TGH. She is the expert, and we call on her several times to find out, are we teaching the latest and the greatest information in our poison lessons? And so we are very, very grateful to Dr. Douge to advise us and to help us and to be the advisor for the Poison Information Center. So Dr. Douge has had a lot of questions from parents, as we have here at Morehealth, regarding poisons and the COVID-19. So I'd like to welcome Dr. Douge, and we're going to have kind of a question answer format. And I will ask her a few questions, and she's going to give us all her expertise and her expert advice. Welcome, Dr. Douge.
Thank you, Karen. Hi, it's my pleasure to be with you tonight.
We are so excited to have you, and there's a lot of questions. So I think the first thing we need to do, we need to start with hand washing. I hear all the time the importance that we need to wash our hands over and over and over and over again. So my first question that many parents have is, so I'm supposed to wash my hands, but what do I wash my hands with?
That's a very good question, especially nowadays. We really need to keep those hands clean, and the little ones need to keep their hands clean too. Hand washing for us, it's simple. We love soap and water. So you want to make sure you get all in between your fingers, under your nails. If you have a ring, make sure you remove it or move it around to clean underneath. So soap and water is good to go. But if you out, let's say you don't have soap and water, then hand sanitizer is very handy. But with hand sanitizer, always supervise the little ones, because as they pump them, they can splash into their eyes or they can accidentally ingest them. So make sure you supervise, and of course, put them away after each use so they don't have access to them.
Okay, but what if I have a little baby, and you know those babies and toddlers, their hands are always in their mouths and all over their faces. What if I put hand sanitizer on their hands? What if they immediately put them in their mouth?
Quick thing, it's best not to use hand sanitizers on little babies. As you know, they love, hand to mouth is very all the time. So we want to make sure you don't use them, but if you did, it's best to call the poison center right away. We're going to be able to help you, give you advice based on the baby's age, weight, and of course the concentration of the product that was used.
Oh, okay. Well, that's great advice. So now I have, I was told to try and find wipes, and they were really hard to find and still are really hard to find. Are wipes better for me to use than the hand sanitizer and soap and water? What should I do about wipes?
Wipes, anything that has like strong chemicals, they're really good for surfaces, but not for our skin. So stick to
Oh,
soap and water or sanitizer if you cannot get access to soap and water. But any chemical or any wipes, leave them for the counters or other surfaces you need to wipe down.
okay. So with that being said, it's hard to find good wipes. So I bought some baby wipes. I don't know if I was supposed to, but I bought baby wipes and I added alcohol to the baby wipes. You know, I think I read over 70% isopropyl alcohol or something like that. Am I allowed to do that? Is that okay?
Some people are doing it. We would rather you don't because alcohol is dangerous, especially to young children, and it's hard for you to control what they do with it. So that high concentration of alcohol, let's say twist the wipes and ingest it or play with it, put it in their hands. So that kind of open doors to all kind of accidental poisoning. So it's best not to. Let's stick to what's already in the air, or just use soap and water, as stated earlier.
Oh, okay. Okay. So, and for hand washing, I think I need to say this. So I just got my water bill in the mail, and my water bill was a little bit high. And I think it's because we've been washing our hands nonstop, and I've been washing all the surfaces. And so when washing our hands, one of the things that we teach at More Health is to make sure that when you turn on the water, get your hands wet and then soap up to turn off that water while you're doing your 20, 30 seconds worth of hand washing. So that's just a little tip from me to say to teach your children to turn off that water in the middle of your hand washing.
That's really good advice. So that's gonna save water, and hopefully your bill will come down.
I hope so too. So let's move into the house. I feel like all I do is scrub, 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 scrub. So give us some tips about sanitizing our house and what should we use to make sure that we clean all the germs, but yet we have a safe environment for our children.
One thing, we don't want people to be obsessed with cleaning the house too much. As long as you know what works for your family, it depends on how many people is in there and how much traffic you're getting. You don't have to be like obsessively cleaning. Any good product that you like, it's hard to say which one will work best. Any good cleaning products that you like, use them. If you don't have a lot of people, we could say a few times a week you can clean the whole house. But high touch surfaces, of course, you want to get those daily.
Okay, what are those high touch surfaces? I have a feeling I'm missing a few.
That's your counter, your faucet, doorknob, light switches, and even your remote control, your phone. We tend to forget that. We use them all the time.
Oh, what great advice. I know that phone is a little tricky. You have to be careful not to put Clorox or something like that on the phone. It might damage it, right?
That's true. It can damage the plastic.
Okay. And you know, something that I was just thinking about was what about my car? Like, you know, we're supposed to stay home for the most part, but when I get into the car, I found myself wiping the steering wheel and the surfaces that children might be touching or things like that. So that's another important area.
It's another good area to clean, but the same thing applies here. Don't do it too much because as you close the windows and everybody's in there, you can be inhaling some fumes, and that can lead to some exposures, and we don't want that to happen.
Okay, so my Clorox, should I mix it with my vinegar or ammonia? Should I mix it to make it even stronger?
No, Karen, we do not
Uh-oh.
recommend mixing any cleaning products. When you clean, if you're gonna use one thing, stick to it. Do not mix. And Clorox, especially, we tend to think of it as a loner. It doesn't like to mix with others. If you mix it with anything like you mentioned vinegar, that can lead to a toxic fume, toxic gas, and you do not want that. So stick with it. Read the label. It's gonna tell you sometimes to dilute it. If it does say that, use the water that it needs. Just mix them according to the instructions, but never mix chemical because that's gonna lead to toxic fumes that can lead to respiratory problems.
Okay. Well, I find that even when I clean just using bleach in itself, it can cause headaches and make you not feel so great anyway. So you always have to have a ventilated area too, right?
You want to make sure you have your doors and windows open when you clean. If you don't feel well, let's say you clean and you start not feeling well, it's best to go outside immediately, get to fresh air, and while you're outside, then you can call the poison center for help.
Okay. Oh, that's such great advice. So important to know that. So, in regards to the COVID-19 virus, I would like to be able to take something, maybe like a vitamin or something. I've heard some things on the news or on the internet about things that maybe I should be taking to try and prevent from getting the COVID-19 virus. One of them was zinc, another one was vitamin C or things like that, or that I'm supposed to be doing. What is your thoughts on that?
You are not alone. A lot of people are trying to boost their immune system. And of course, with social media, they're learning different things to use. And vitamin C and zinc has been on their list. We do not recommend taking anything, any supplement at all to boost your immune system because right now, nothing is really recommended to prevent COVID-19. And if you're going to use something, it's best to talk to a healthcare professional. Your healthcare provider knows your medical history. They'll be able to tell you should you take anything. And this is critical if you're on prescription medication. Never take anything over the counter. Do not add anything to your regimen because you can end up with some negative interactions. So you don't want any side effects that can lead to your medication not working or even lead to poisoning.
Okay. That's great advice. So I know this is a crazy question, but what happens if I make a mistake? So let's just say I have my hands on a surface that maybe was contaminated or something, and then I touch my eyes or my mouth or do something. I heard somebody thought they should take some isopropyl alcohol. It's a hard word to say, and like wipe out my mouth or things like that. So I don't think you should be doing that, right?
No, we should not be using alcohol or any chemical on the skin, just like we should not ingest them. Soap and water, again, is going to work well on your face. Keep those hands clean. And of course, our daily hygiene just matters also, but no alcohol, nothing on the skin.
Okay, so now let's just say something bad has happened in that we have potential poisoning. Am I allowed to call the poison center myself? Do I need to call my doctor first or what? Tell us about the Florida Poison Information Center.
That's a great question. Anyone can call the Poison Control Center. The general public, even healthcare professionals should call the Poison Control Center. And there is no charge when you call us. We are an information line. So when you call, you're going to speak to a healthcare professional. It's going to be a doctor, a nurse, or a pharmacist. And they will be able to help you right in the comfort of your home. And a lot of time, you don't even have to make that trip to the emergency room. They'll be able to triage and let you know should you be able to choose to stay home or if you need to go to the emergency room. It is a free call. So, and we are 24/7.
Oh, wow, that's fantastic. So even if I have a simple question, then I should call. That I'm not.
Yes, you can call if something bad happened, but you can also call for information and with questions.
Okay, so I'm going to ask you several times. What is that phone number?
That number is easy to remember. It's 1-800-222-1222.
Okay.
And we like to tell people you never know when you're going to have an emergency. So save that number on your phone. And that way, if you're out and about, wherever an emergency happens, you can pick up your phone and call us. Once again, it's 1-800-222-1222.
Okay, that's fantastic, and that's a pretty easy number to remember. So that's great. For lately with the COVID-19 virus, have you had any consistent questions or things that you're getting repeated calls over and over and over again? A certain message that you would like to share with the audience tonight?
Those questions that you just asked, a lot of them are what we're getting. People are cleaning a lot. They want to know about mixing chemicals, what can they use to help themselves, and what can they use around children. Those questions that we keep getting them. The main thing to remember is that yes, COVID-19 is there. Yes, we need to clean, but do not overdo it. And of course, when you're going to clean, make sure you're using gloves. Do not touch chemicals with your bare hands. Have your windows and doors open and never mix chemicals. And of course, put them away each and every time. We don't mean under the sink, put them up high, somewhere above your shoulders, so children are not able to reach them. And never mix chemicals again, and keep them in their original containers. That's how you can end up with lookalike poisoning. Remember, you showed us earlier they look similar. So never put them in different containers. Keep them on the original one and read the label, follow the instructions.
Yeah, that reading the label is especially important. Another lookalike I wanted to share, and this is kind of a crazy one, but here is a cleanser, Comet cleanser, but it looks, the coloring and the shape and the sound looks very similar to small children as Parmesan cheese. And so if you, little ones that can't read, they may think that this is something, good cheese to put on their food. And so we want to make sure that parents, especially, like what you said, Dr. Douge, make sure that you keep your cleansers and things like that in the original container. Don't put it in a little glass and have it sitting on top of the kitchen counter. So that's really important. And then lastly, Dr. Douge, next week on Tuesday, we're having another virtual event, and it's focused on mental health and stress as related to children and adolescents and the COVID-19 virus pandemic. And I'm sure you do get calls, and I know you're a specialist in the area of substance abuse and overdosing and kids taking medications out of their, parents' medicine cabinet and things like that. So share with me a little bit about some of the issues with depression and families all really having a tough time during this time with the COVID-19.
This is a time where a lot of people are stressed, and we are at home. People might have a lot of stress coming up, and they might tend to use substances that's in the home. So if you're on medication, I would say be mindful of how many pills that you have. You may not know who in the house have a substance problem. And of course, with small children, we do not want medication to be on the counter, on the purse. They can get to them. And if you feel like somebody in your household need help, go ahead and call and ask for help, because we all cope with stress differently. And the last thing we want, if somebody was doing well on their medications or they're not having any relapse, we don't want them to start having relapse. And of course, never go to alcohol or any substance to try to ease our pain or try to make ourselves feel better. That's how it starts. So if you feel like you need help, it's okay. We all stress. It's normal to ask for help.
Oh, that's great advice, and that's the most important thing is that you're saying is really if you're struggling to communicate and communicate that even to your children to say this is a tough time and we're going to get through this, we're going to be okay, and we're going to bond together, and that they're not alone. And I think that's the most important thing, and to not revert to or to get to any of those self-medications that can happen. Well, this has been such great information, and I do want to share with our listeners tonight that we have on the More Health website, which is www.morehealthinc.org. We have put together a short version of our poison lesson. It's about 10, 12 minutes long. And of course, it's free and it's downloadable. And if you just go to our website and just look for the Virtual Health Center, we have 4 lessons in there. One's on poison, one's on bones, and another one is on skin cancer prevention and head and all kinds of great lessons. And then we have all kinds of resources for our parents. So we would encourage you all to go to our website and get those resources. And then in addition, after tonight's event, you will be sent an email that has all the links to our recorded version of this. So we encourage you all to share that with your friends and family and on Facebook and social media. And we also encourage you to keep it and to use the resources, and a lot of great resources for the Poison Information Center. And I'm telling you, Dr. Douge, you guys are just rock. You guys are the best and so friendly on the phone. And we're so proud to be partnering with you and to have Tampa General as our founding partner. And then finally, I just personally want to wish everyone a very safe and healthy Memorial Day weekend, and hopefully to invite you all to join us for next Tuesday night, where we talk about stress and the COVID-19 virus, especially related to children. And Dr. Douge, you can end the program tonight.
Thank you so much. It was, I mean, amazing. I'm glad we got to answer their questions. And if anybody have more questions, go ahead and send them. We will do our best to reach out and help. Remember the Poison Control Center, we 24/7. We are here for everyone. So give us a call and save that number on your phone if you ever need it. And the number is nationwide. So wherever you go, that 1-800-222-1222, that's all you need to have. It will connect you to your nearest Poison Control Center, and somebody will be able to help you who is a healthcare professional. Thank you so much for all you do, Karen, and thank you.
Thanks, everybody. Good night. Have a great weekend.
Thank you.